Welcome to The Explainer. Today, we're diving into a hidden medical danger that often goes completely unseen until it's way, way too late. We're talking about a condition that can escalate from a tiny, insignificant wound to a major amputation in a terrifyingly short amount of time. You know, this single line from a clinical guide, it just perfectly captures the threat of what's called a deep foot infection, or DFI. See, it doesn't announce itself with big, loud, obvious symptoms. Nope. It's subtle, it's deceptive, and that's what makes it so incredibly dangerous. Okay, let's get into this medical mystery. So, first things first, we gotta understand our culprit here. DFI is the silent killer of limbs for one simple reason. It's a master of disguise. It's an infection that gets a foothold deep inside the tissues of the foot, far, far away from what you can actually see on the surface. Right, so here's the case file on DFI, and honestly, it's a perfect storm. First off, the infection is hidden, right? It's thriving underneath skin that can look totally fine, maybe even normal. Second, it moves with terrifying speed. We're talking about irreversible damage happening in just a matter of hours. And here's the kicker. It has two key accomplices: nerve damage, or neuropathy, which masks the pain, and poor blood flow, or ischemia, which masks the classic signs of inflammation like redness and warmth. So the patient, they often feel nothing at all while this disaster unfolds. And this is where you can really see that stark contrast. On the surface, you might just see some soft tissue that looks okay, or maybe a tiny little wound. But underneath, oh, it's a catastrophe. A deep abscess could be forming. The infection could be using the tendons like highways to spread through the foot. And while you see no redness or warmth on the skin, you could literally have flesh-eating bacteria active down below. It is the ultimate deception. So if the surface is so completely unreliable, how does a medical detective even begin an investigation? Well, they know you can't trust what you see at first glance. Instead, they're trained to look for a very specific set of red flags, clues that suggest something much more sinister is happening down in the deep. And these are the red flags we're talking about. If a clinician sees any of these, the alarm bells start ringing. Unexplained swelling of the whole foot, even with just a tiny wound. Pain that feels way, way too severe for what the injury looks like. Blisters, weird skin discoloration, a sudden change in wound discharge. If any of these show up, the protocol is crystal clear. You treat it as a deep foot infection until you can absolutely prove it's not. Okay, so once DFI is suspected, that's when the investigator really opens up their forensic kit to gather hard evidence of what's happening beneath the skin. This isn't just about looking anymore. It's about seeing into the body to really build the case. So you've got this whole toolkit, right? The investigation almost always starts with a mandatory baseline X-ray. It's great for spotting things like gas produced by bacteria or obvious bone damage. But to really dive deep, you need more advanced tools. An ultrasound can pinpoint pockets of fluid, and a CT scan is fantastic for getting detail in a hurry, like in an emergency setting. But here's the thing, the MRI, that's the gold standard, no question. It has a stunning 95% sensitivity for detecting something called osteomyelitis. That's an infection that has gotten into the bone itself. This makes the MRI the most powerful tool by far for seeing the full, terrifying extent of the hidden damage. It can track the infection as it spreads and reveal the true battlefield. But, tech is vital, but it's not the whole story. You still need that hands-on detective work. A skilled clinician uses physical techniques and even their own senses to uncover the truth of what's happening in those deep tissues. Check this out. It's called the probe-to-bone test. It's surprisingly simple, but man, is it revealing. A clinician takes a sterile, blunt probe and just gently explores the wound. If that probe goes deep enough to make contact with a hard, gritty surface, well, that's bone. The test is positive, and it's treated as osteomyelitis, which, believe me, requires very aggressive treatment. And there are other physical clues, too. A uniformly swollen toe, the sausage toe sign. Yeah, it sounds a little funny, but it's a huge clue that often points to an infection in the bone right underneath. And this is just fascinating. The smell test. An experienced clinician can sometimes identify the type of bacteria just by its odor. A sweet, metallic, or foul smell can point to deep anaerobic activity. These are signs that rely entirely on experience and just sharpened senses. And all of this brings us to one of the most dangerous and honestly one of the most descriptive concepts in this entire investigation. It's a term that just perfectly captures the deceptive nature of this enemy. So what exactly is an iceberg ulcer? And there it is. This is the core problem. What you can see is just the tip of the iceberg, a tiny, harmless-looking little opening. But beneath the surface lies a massive, hidden cavity of destroyed tissue and a raging infection. This is the classic, terrifying presentation of a deep foot infection. So all the clues are on the table: the imaging, the lab work, the physical exam, and now a decision has to be made, and it has to be made fast. The verdict here is guided by one single overriding principle: you cannot wait. If a doctor sees any one of these findings, it's go time. A fever combined with foot swelling, any gas seen on an X-ray, rapidly spreading redness, these are all signs the infection is totally out of control. The verdict is in. This requires immediate surgical assessment and powerful broad-spectrum antibiotics to fight the infection systemically. There is absolutely no time to lose. And this really gets to the heart of it, the ultimate golden rule for this entire protocol. Antibiotics are absolutely crucial, but they can't get inside a walled-off abscess. So the only way to save the limb is through surgery, to find that hidden pocket of infection, open it up, and clean it out. The source of the infection has to be found and physically removed. So if you take away just one thing from this explainer, let it be this. In the world of complex foot wounds, you can never, ever trust the surface. A small ulcer does not equal a small problem. You have to respect the red flags and always question what kind of killer might be hiding in the silence beneath.